I'm always angry.
Left ventricular hypertrophy is a transformation of the normal left ventricle, or Dr. Banner, to the Hulk. However, we can spot this transformation by 3 easy ECG criteria. But we will go further and find something better than ECG. I know it's hard to believe that something can be better than ECG, especially if you love ECG as I do. But yes, for hypertrophy, something is better. So, by the end of this video, you will know all about reasons of left ventricular hypertrophy and diagnostic criteria in those patients. But first of all, what is a left ventricular hypertrophy in general? The left ventricular hypertrophy is a growth of left ventricular mass caused by increased cardiomyocyte size. But wait a minute. Why did the left ventricle become hypertrophied? The main reasons for left ventricular hypertrophy are hypertension, aortic stenosis, both mitral and aortic regurgitation, hypertrophied cardiomyopathy, ventricular septal defect, and others. But don't forget that left ventricular hypertrophy can be caused by physiological adaptation to strenuous physical exercises. Let's come back to ECG criteria. First of all, you need to use relevant ECG criteria, so we will use criteria according to the newest European Cardiology Society guidelines of hypertension. And the first and most well-known ECG criterion is the Sokolow-Lyon criterion. For evaluation of this, you need to measure S5 amplitude in V1, which in our case is 20 mm. And after this, measure the R-wave amplitude in V5, which in our case is 27 mm. So if the sum of both S-wave amplitude in V1 and R-wave amplitude in V5 is greater than 35 mm, it fits the Sokolow-Lyon criterion of left ventricular hypertrophy. In our case, the Sokolow-Lyon criterion is 47 mm. The second ECG criterion is R-wave amplitude in AVL, which is greater than or equal to 11 mm. In our case, is exactly 11 mm. So the second ECG criterion of left ventricular hypertrophy is present. The last criterion is Cornell Voltage, which is the sum of amplitudes of S-wave in V3 and R-wave in AVL. Let's check the S-wave in V3. The amplitude is 7 mm, but here we see decreasing of the voltage by half, so amplitude in V3 should be doubled. As a result, S-wave amplitude in V3 is 14 mm. Our patient is female, so the cutoff point for the Cornell voltage is 20 mm. In our case, Cornell voltage is 25 mm, so the third and the last ECG criterion of left ventricular hypertrophy is present. As I promised, the best way to evaluate the left ventricular hypertrophy is the echocardiography. There are only two criteria of left ventricular hypertrophy by the echo, and the first one is the left ventricular mass index to height, or body surface area. For calculation of the left ventricular mass, you need to measure interventricular septum thickness, internal left ventricle diameter during the diastole, and posterior left ventricular wall thickness. And the second criterion is relative left ventricular wall thickness, which is necessary for evaluation of the left ventricular geometry. But about the geometry in 1 minute. Relative left ventricular wall thickness is calculated as 2 posterior wall thickness divided by internal diameter of the left ventricle at the end diastole. But the good news, you don't need to do any calculation by yourself. You only need to measure. So according to these two parameters, left ventricular mass index and relative wall thickness, we classify left ventricular geometry in 4 categories. Normal geometry, when both left ventricular mass index and relative wall thickness are normal. Concentric remodeling, when left ventricular mass index remains in the normal range, but relative wall thickness is greater than 0.42. Often concentric remodeling is seen in early stage of hypertension before the left ventricle hypertrophy develops. If both left ventricular mass index and relative wall thickness are increased, this is called concentric hypertrophy. It is typically results from the pressure overload of the left ventricle, for example in case of hypertension or aortic stenosis. In case of concentric hypertrophy, wall thickens without significant chamber dilation, which leads to reduced compliance and diastolic dysfunction. And when the left ventricular mass index increases, but relative wall thickness remains in the normal range, it is called eccentric hypertrophy. Usual reason for this is volume overload of the left ventricle, like in the case of aortic regurgitation or dilated cardiomyopathy. In case of eccentric hypertrophy, the left ventricle dilates, while the wall thickness increases proportionally. If you like the content, press like and subscribe buttons and have a good day.